I'm Lynn Onstot with the City of Joplin. Welcome to Joplin Insider. This is a program to give you details and some behind-the-scenes look at different departments here at the City of Joplin. Today we're going to focus on the Health Department. We're breaking the show up into two different segments. The first portion will be with the Medical Services Division, and then the second portion will be with WIC Department. And today, doing the Medical Services is the Division Coordinator, Cynthia Burnham. Welcome.
Hi, thanks for having me.
Yeah, actually the coordinator of the medical division, if that's the way to say it. I'm not sure, but just appreciate you being here. You've been with the city for a number of years. How many years have you been there now?
6 years.
6 years. So that's quite a while, and probably getting your feet wet and seeing all sorts of things going on. Some people may not even realize the different services the health department offers. I know people think of medical, they think of immunizations. You know, we do that a lot. But I know you do a lot of other preventative care and other treatments. So really, let's just start from the top. What kind of services did the medical division provide?
Well, immunizations is a big service that we provide. We also do TB testing for people who need it. We do STD testing and treatment when it's needed, and we issue temporary Medicaid for pregnant women so they can get in for early prenatal care.
Well, those are all very important. Now, the TB and STD, are those ordered? Is that something people just know they need? Is that something ordered by a doctor? Or how does that work? How do they get to your division, get to your department?
TB testing is required for some organizations, such as students in a medical school or a nursing program. Some organizations like nursing homes might require it, and they can come to us for it. We also do it if there is a risk for TB. The charge depends on whether it's required because they've been exposed to a case or whether they're doing it for a school or something like that.
Okay.
STD is by need. If they feel like they have symptoms or have been exposed, then we can discuss with them whether we can do that for them.
Okay. So yeah, you sit and you sit with them and talk with them a little bit and find out what their needs are. What about when people are traveling? Is that something that you're able to help people with if they need, if they're going to a part of the world that you hear about, you need your shots, and I don't know exactly what those are. Mm-hmm. I haven't traveled that far, but can you do any of those, or is that something they need to go to their doctor?
We can screen people and send them to a place if we are unable to do it. We do a lot of vaccinations that are needed for overseas, such as if a country is endemic for hepatitis A, we can do that. There are some we are unable to do, but we can refer them to sources if they need that.
So you're a resource. If you're not able to do it, you because they need to navigate the waters of where do I go for this.
And I like to say that's one thing we can do for any question they have regarding their health. We may not be able to provide all the services, but if they have a question, perhaps we can lead them in the right direction.
That's a great resource. So you mentioned hepatitis A. I know recently we've had some discussions about hepatitis A in our community. Can you broaden that a little bit and help our viewers understand what hepatitis A is?
Hepatitis A is one of the liver diseases, and it is spread fecal-orally, which means somebody ingests a little bit of fecal matter, or it can be spread through other ways as well. Hepatitis A is typically not very, we don't see it in our area. We've had 0 to 1 cases over the last 4 years.
Oh, wow.
However, in 2019, we've already seen 5 cases. And this is actually a national outbreak that then reached Missouri, and now it has begun coming down into our area with these 5 cases. They can prevent it by getting a vaccination and by washing hands very well. The at-risk populations are men who have sexual contact with men, the homeless population, and drug users, whether it's intravenous or oral drugs. So if you are in that population or you have close contact with anyone in that population, we urge you to give us a call so we can get you vaccinated.
It's kind of alarming news that that it can be spread that way, but you do need to be careful. Now the hand washing, that's something we all learned as a child and about hand washing. What tips do you have for hand washing? Just remind us, because I think a lot of people just take it for granted anymore. They use the antibacterial Germ-X or whatever it is. So what about hand washing? Why is that so important?
Well, soap and water is going to conquer that contagion if they encounter it. So that's what we want them to use. hand washing from even a tiny child that knows happy birthday, if they can get their hands wet, soap them up, rub them good, and tell them to sing happy birthday twice, even a child can do that. Anyone who is in food service, daycare, or just if we use a public restroom would benefit if we wash our hands and mentally sing happy birthday to yourself twice while you do it. It's about 20 seconds. That's what we want to do for good ample hand washing. When you're done, grab a paper towel, turn the water off, and if you're in a public restroom, you'll want to even open the door with a paper towel so that you don't recontaminate your hands.
Right, because again, somebody who may not have washed their hands has touched that doorknob.
Right.
I'd started seeing that probably a couple of years ago, and I thought, it's a very good idea because you just don't know. And I am a firm believer in wiping down carts or anything, if you're going to a public store, to wipe those down if they have those available. And
more and more stores are putting those disinfectant wipes right there by the shopping carts to wipe the handle before you grab it.
Yeah, and it's pretty easy to do. So, well, it sounds like you provide a variety of immunizations. So is it for all ages and insurance, non-insurance? I mean, how do you qualify for that?
We have vaccine for insured and uninsured. The uninsured, we can, there's a small fee of $13, irregardless of how many vaccinations they get. It's per person. So if you come in and you're uninsured and you need 3 shots, we can give you those for a $13 copay for each visit. If you have insurance such as Medicaid, Medicare, we can see if you qualify. Private insurances, we contract with several of those, so there's quite a few we can vaccinate as well, and if their insurance pays for it, there's no copay for those at all.
Okay, and again, they can come in and you help them. They don't have to know all of this before they walk in the door.
No, you can give us a call, come in, and we'll walk you through that process. And we have those vaccinations for adults and children.
Well, that's great. Now, do they need appointments?
We prefer appointments. Appointments simply help us to know how many we're going to encounter. We also have times the nurses are out for training or we're short one, somebody called in sick, and we are a very small department, so we do prefer appointments, but if somebody walks in, we're going to do our best to serve them. They just might have to wait a minute more.
Right, well, and that makes sense. I mean, in today's world of immediate response, that people expect that, but they also need to learn to wait, because I know I've had to do that too. If I don't make an appointment, well, that's my fault. That's on me. So what about pregnancy testing or anything like that? Do you do those?
We do pregnancy testing, and we can issue temporary Medicaid to somebody who qualifies. So if a woman finds out she's pregnant and doesn't have insurance and needs quick medical care, we want them to call and come in, and we can issue them a Medicaid that's good anywhere from 30 to 60 days, and it allows them to file for the longer term Medicaid, and that way they can get in quickly to a physician.
Right, yeah, because prenatal care is very important.
And the earlier the better.
Right, and we're going to talk to Joyce in a little bit about WIC and what they can do on that end, so that's great. So I get calls, I take a lot of phone calls for the city, and I get calls about birth and death certificates. Is it only at the state of Missouri that they can get those?
We can do state of Missouri issued birth and death certificates and print them off right in our office. It takes about 15 minutes. You come in, you bring your photo ID or 2 other forms of IDs. It costs $15 for a birth certificate and $13 for a death certificate, $10 for additional death certificates if you need more than one, but $15 per birth certificate. You fill out a form for us, show us your ID, and we're going to print that off right there for you. It has the raised seal that's required by a lot of, for instance, Department of Revenue. It has a raised seal so they can get driver's license and issues. We also have all 50 states forms, so if you were not born in Missouri and need those, we can get those to you.
Now that I did not know. That is very helpful, because we do, people are mobile. I am learning how many people have moved to Joplin, and they need that service, so that is good to know. I know I've asked a lot of questions. There's probably other services and other programs that you'd like to talk about. What else am I missing?
Well, I think one thing to know, you mentioned in the very beginning, and that's preventative. We are on healthcare coalitions. We look at the major concerns in our area in chronic disease, because chronic disease is what causes a lot of the issues that people deal with, heart disease, diabetes. And we look at the top indicators in our area periodically, and then we do things to plan. For instance, right now we are doing a walking initiative called Live Smart Walk. We urge people to look it up. There's hubs going because safety is one thing that'll get people walking something anybody can do almost, regardless of their health status, and increase their health, and that's what we want to do.
Okay, Live Smart Walk.
Yes.
And it's available on the website?
It's available on the Live Smart Walk web. We have livesmart.org, southwestmissouri.org. They can look it up there. They can just Google it. We have a Facebook page, but the important thing is to find a group and start walking.
Right.
And we have people who can come and train a walking leader if you want to start one.
So if you have a group like in your neighborhood,
Yes.
or maybe you're at work, so if they're interested in that, they could contact you and you would work with them to form a walking team, so to speak?
We will, and we are currently beginning to visit churches, businesses, organizations, neighborhoods, with the goal of telling them about walking and the social aspects of walking and how that benefits more than just physical health, but the mental health as well.
Right.
So we try to get them walking because we did find out women do not feel safe walking alone. And so if we can get a group not only of women but of men and their children walking, they have social aspect and the physical safety that they can get out and do that.
I think that's great, because people walk at the mall, you see them at the parks. Most of our parks have the loop trails and things like that, but there are a lot of other trails that are linear, and so yeah, when you're walking by yourself, you're walking out a ways and then having to come back. So it is nice to have somebody to walk with, or even in the neighborhoods. They don't have to walk a certain path or a certain area?
Nope, each group that has formed selects their own day to walk, their own time to walk, and the own path. Some of them change it each time. Others, for instance, Webb City Farmers Market walks right there in a loop near the farmers market on Saturday mornings. Carl Junction has one, MSSU, Access Family Care, and
Well, you've done some work on this already.
We are starting others, and we just urge anybody watching, if they have a group that thinks they want to start one, give us a call. We have people that'll come out, provide the registration packets, the liability forms, and training to train a walking leader.
Okay, well, what if it's an individual who just wants to join a group? Can they, call you and maybe find out?
They can. We can connect them to hubs, or they can go to that Facebook page, Live Smart Walk. The last post has the current hubs that are walking, and they can find out when they walk.
Is that on
Contact them.
Facebook or is that a website?
That is a Facebook.
Facebook, okay. Okay, so they need to go on Facebook. That's good to know, and I'll use that in my information when I publicize the city. So I know you've been working on Live Smart Walk for a little while, and I didn't realize how much work had been done already.
Yep, there's a lot of organizations working on it and more to come.
Okay. Well, is there anything else? We're wrapping up, but I wanted to give you one last opportunity. Just appreciate you being here. Is there any tips or advice?
No, I do want to just say we work on a lot of different things, including emergency management and preparing for any kind of thing that might happen that affects the health of the people in the city. If you have a question or a concern, whether you be an individual or an organization, you can give us a call. If we don't have the answer, we'll do our best to try to find it for you.
That's a great resource. Thank you so much, Cynthia. I appreciate it. Well, that wraps this portion of Joplin Insider up, and I'll be right back. Thank you.
What's up, Rory?
Hey, Robert. I thought you might want to give that game a rest and get outside for a bit.
Wow, this is great. Thanks, Rory.
The real adventure is lived in real life.
Well, welcome back. This is the show that we're focusing on the health department. And now I have Joyce Doty with me. She's the coordinator of the Joplin WIC program. Welcome.
Thank you.
Well, tell me a little bit about WIC. What does WIC stand for?
WIC stands for Women, Infants, and Children. It is a supplemental nutrition program providing services to pregnant women, new moms, infants, and children up to their 5th birthday.
Okay, so when do they enter the program? When do women, I guess?
Well, eligibility is based on their nutritional risk and income, and they can come in prenatally.
Okay.
They can come in once they've had the baby, or they can come in as children. I mean, it doesn't. There's not a
set time.
There's not a set time they can come on. They can be added at any time.
Okay, that's what I needed to know. That if I missed it in my early pregnancy, am I out of luck?
No, you're not. You can still come.
Good deal. It wouldn't be me, but for those other ladies that might need.
Sure.
So, how do people register? How do they know about it? How do they get signed on, I guess?
Prenatals are seen, we usually see them in our office on Wednesdays at the Joplin Health Department. We see them between 8 and 10:30 or 1 to 3:30 for prenatals.
They've got that on the screen for you. That's wonderful. So.
And then the mom and babies, they're seen on Mondays or Tuesdays, 8:30 to 10:30 or 1:30 to 3.
Okay.
Then children are seen Monday through Thursday, 8 to 10:30 or 1 to 3:30, and those three types, the prenatal and the moms and babies and the children, they basically need to allow an hour for each appointment. The appointments are limited, and they need to bring proof of information with them to that appointment. Nutritionist appointments, those are done Monday through Friday, 8 to 11 or 1 to 4. And the next slide shows us the information that they need to bring for proof of income, proof of residency, and proof of ID. It also tells them to bring their medical card if they come. They don't have to have a medical card, but if they have one, we want them to bring it. And if they're already on WIC, to bring their folder with them to those appointments when they come. We do them on a walk-in basis. So they just need to come to the office or call our office, and we can get them set up with what times they need to come and what they need to bring.
So that first appointment is a walk-in.
Correct.
And then from there, then they start setting appointments depending on what age and what category they're coming in.
Everything is done in a walk-in basis at the main office.
Oh my gosh, I did not realize. You girls, and men, I guess, in the office must be very busy not knowing who's going to walk in the door and the numbers.
That is correct.
So tell me, how many are on staff?
We have 13 members on staff. We have 2 senior clerks, 3 certifiers, 4 nutritionists. Then we have 2 peer counselors that work with our breastfeeding moms, and we also have 2 Spanish interpreters. And then along with those qualifications, we have some additional training qualifications where we have 4 lactation consultants, and we have 3 registered dietitians on staff.
Wow. You guys do a lot.
We do.
So you mentioned the lactation specialists and things like that. Before I forget, I want to congratulate you and the WIC program for the, if I get it right, the 2019 Loving Support Award of Excellence. And it's from the Department of Agriculture, the United States Department of Agriculture. You were one of 2 recipients who received the Gold Premier level from the state of Missouri. So that's a pretty high award, one of 2 throughout the whole state. What criteria is that based on? What have you had to do to win such honor?
A lot of it has to do with answering some questions, and those questions have to do with local agencies that have provided outstanding breastfeeding promotion and support activities. Agencies must have programs that increase the percent of exclusively breastfeeding infants over the past year. So I have our rates, our breastfeeding rates for duration of breastfeeding at 12 months in 2017 was 13%, and for fiscal year 2018 it was 13.4%. So it went up just slightly, but any increase is great. And then also our breastfeeding initiation rates from fiscal year 17 was 71.3%, and then in FY18 it was 71.7%. And our agency also works with a lot of community partners through our Breastfeeding Coalition of Southwest Missouri to connect with the hospitals, child care providers, businesses, and others to increase support for breastfeeding moms in our community.
Well, I do know, since I've gotten to know WIC and know more about it, and it seems like there has been more of an awareness level about needing to provide a space for a breastfeeding mother, at work or out if you're shopping, in public places, and it's something that's becoming, I think, more acceptable. Do you find that to be true?
Yes, I think that's true, and we've got, there's so many people out there that are supporting them that I think they're starting to feel that that's starting to get better now. There is a place for them to be able to nurse their baby or to pump if they're at work, those type things.
Yeah, well, now is there a group of moms that get together and talk about this or, support each other?
We do. Our peer counselors, our 2 peer counselors that we have, one of them is a lactation consultant, and they have the Chi Chi Mamas Breastfeeding Support Group, and it meets the first Thursday of the month at 5 o'clock. And I believe there's a slide up now, and it talks about even the Facebook page that we have. So you can go to Facebook and connect with the peer counselors there to give information on breastfeeding.
Yeah, because again, you've never done it, it's a whole new thing, and you do have questions and different problems, issues,
Sometimes
whatever.
even if you've done it, each child is different.
That's probably
so it can
true.
be
Yes, you're right.
A challenge, definitely.
Yeah, each one's different. That is true. So I'm kind of bouncing around the questions, and I don't mean to do that to you. But when we talk about WIC, you have a lot of services, a lot of different things. Is there a cost for those?
There's no cost for them to receive our services.
So
It's
for all of this
provided.
care, all of this counseling and nutritional education, things that you're doing, it's free to those
Correct, that qualify.
that qualify.
Yep.
And did we talk about how they qualified? I know that you talked about what they bring in.
Just basically talked about that it was a nutrition, risk, and income are the two
Okay.
qualifiers. And then we provide them a supplemental food prescription for those
Okay.
eligible participants. And the food prescription is high in protein, iron, calcium, vitamin A and C. Participants receive some food items like fortified milk and cheese, eggs, whole grain bread products, and hot or cold cereals, 100% fruit juice, and then they also receive fresh or frozen fruits and vegetables.
So all the good stuff that you need, and they're able to do that. Because sometimes, they may need some supplement, whether it's, food or income or what, money, but this is providing them some of the grocery
The
items.
food items,
Yeah,
yes,
the food items.
correct.
So they can go, if they have utilities and things like that. So, and it's year round. There's
Correct.
Go ahead.
We also provide, the program recommends breastfeeding. That's what we really encourage and have a lot of support for that. And so for those, we provide breastfeeding support, baby foods, and infant cereal. And then for women who cannot or choose not to breastfeed, the infants may receive supplemental iron fortified formula. So we're providing for every situation for up to that age 5.
Right, and I think that is wonderful because each situation, each family has different scenarios and different reasons, health concerns, or
Correct.
Allergies, are they starting to be a part of this? Are you having to test for allergies or know about allergies?
We don't do any testing for allergies, but if they have a diagnosis of some type of an allergy, we can sometimes alter their food package to cover that.
So-
If they're on something special because the child has some additional needs, that might be something that we can also provide too.
Okay, that sounds great. Now I know WIC is in the Joplin Health Department, is that right? Where's it?
Correct. It's located inside the health department on the upper level, and you go to the counter on the right-hand side.
Okay, so that's right across from the chamber. What's the address?
321 East 4th.
Okay. Well, of course I know where it is, but I just want to make sure people know where it is.
Yeah.
Now, is that the only WIC office in the area?
No, we actually have an office in Carthage. It's a satellite office of ours. It's at the Jasper County Health Department. Their address is 105 North Lincoln, and staff from our office from the main site travel to Carthage to provide services by appointment on the first 3 Thursday Fridays of the month. And if you're not sure of the dates, you can call the main office to confirm the dates. And that one is done by appointment because we have to know what to expect over there because we have a lot smaller staff over there.
Oh, okay. You also mentioned you had translators?
We do. We have 2 Spanish translators. They are at the main site on Tuesdays.
Okay.
And then they're at the satellite clinic both the Thursdays and Fridays that we're there.
So the Hispanic speaking community is being served very easily then?
Certainly, yes.
Okay. What am I missing here? Some of the highlights we hit upon, but I know there's a lot going on with WIC.
Well, basically, we have something new that's coming along. We're going to be having eWIC. It's coming June 29th of 20.
Okay.
So there's been a lot of talk of this. We've been talking about it for about 10 years, and it still hasn't happened yet. We had some dates originally, and those got canceled. So this is the projected date is the end of June that we will be starting this. And what it is it's going to be a card. Right now, they get paper checks that they take to the store, and it's going to be called an EBT card. And so all their information will be loaded onto that one little card to go to the store and get what they want, and they can pick things up as they need them instead of having to pick up everything on that check at once. So I think it'll be great benefit when we get there.
So they can kind of come and go, that it's not a all one shopping trip
Correct.
Because that can be stressful. I mean, even for me to get everything on my shopping list, I can't imagine having specific items you have to go search for and things like that. It's kind of like a scavenger hunt.
Correct. And also it'll have an app where you can actually check that item right there to be sure it's one that's going to be allowed on WIC.
Oh, well, that is wonderful.
And you can mix your basket with what you're normally shopping, and it's going to pull out those things that are WIC and pull those off your WIC check, and then so it's going to be a lot easier for them at the store. So I think we'll have some people coming back on our program that felt that it was difficult.
Well, it is kind of hard. I mean, I've even shopping, you know, if I'm shopping with a girlfriend or, you know, my mom or whatever, you know, trying to keep things separate, that can kind of be a pain. So I can imagine what they're feeling too, and especially if you have young children with you, you know, if you have your kids with you.
Sure.
That, with or without sorting things, that can be stressful.
Correct.
So, well, I think you have a lot of great opportunities for young moms, and are dads involved in this program too somehow?
If the dad has the children in his care, dad can come on the program. He won't get anything for himself, but this program is designed for the children. The food prescription is for the children or the infant or the mom to get their nutritional status back to a good state. So dads can certainly bring their children and have them on the program.
Well, that's another great added service that I did not know about. So it sounds like you're doing great things with WIC. Anything else that you'd like to cover before we wrap up?
I think we got everything covered.
Well, Joyce, you're doing a great job over there, and I had no idea it was walk-in. I thought it was appointments. So
yeah, so please come see us.
Yes, definitely. So if you have any questions, of course, you can always call the health department. They're wonderful to work with, 623-6122.
And the WIC office is 623-1928.
See, there you go. So, well, thank you very much. I'm going to wrap this episode of Joplin Insider with the Health Department. I appreciate you watching today, and if you have any questions or have ideas for programs, please give me a call at the city. I'm Lynn Onstot. Thank you.